everyone, and welcome back to PTCB Prep Guide. Our goal here is to break down complex pharmacy topics to help you absolutely crush your exam. Today, we're jumping into the male reproductive system and the pharmacology you for sure need to know.
Okay, so here's what we've got on the menu today. We're going to cover the key definitions, the basic anatomy, and of course, the must-know medications. We'll even throw in some killer memory tricks to make sure this stuff really sticks for your exam.
So, we've structured this to make it super easy to follow. We'll start with the fundamentals, then build up to the core pharmacology, and we'll wrap it all up with a quick review to get you totally prepped for test day.
All right, let's get into it, starting with the absolute building blocks. You know, getting a solid handle on these key concepts is going to make understanding the medications so much easier later on.
So, where does it all start? With these little things called gametes. Just think of them as the seed cells for reproduction. For males, that's sperm, and for females, it's the ova, or eggs. And the really crucial part, each one only carries half the genetic material. And this is where it all comes together, fertilization. It's that amazing moment when a sperm cell and an egg cell fuse, they combine their DNA, and boom, you have a complete set of chromosomes, kicking off the whole process of creating a new individual.
Okay, with those key terms down, let's get into the actual anatomy. We're basically going to follow the incredible journey of a sperm cell, right from the moment it's created. You can really break the whole system down into 4 main parts. First, you've got the testes. Think of these as the powerhouses where sperm and testosterone are made. They're kept in the scrotum, which is like a natural AC unit, keeping things at just the right temperature. Then there's the duct system, which is like a highway for transport, and the accessory glands that add fluids to the mix. This slide just lays out the whole trip, step by step. It all kicks off in these tiny tubes inside the testes called the seminiferous tubules. Then the sperm head over to the epididymis, which is this crazy long 16-foot coiled tube, to mature. Once they're ready to go, they travel through the vas deferens and eventually exit through the urethra.
All right, let's get to the good stuff, the pharmacology. This is where we connect all that biology to the drugs you are definitely going to see on your exam.
When it comes to male hormones, testosterone is the undisputed king. It's the main androgen, and it's what drives all those secondary male characteristics we see during puberty, like a deeper voice and facial hair.
Okay, so when we use androgens as a drug, they actually have 2 different jobs. You've got the anabolic effect, which is all about building up the body. Think more muscle mass and stronger bones. And then you have the androgenic effect, which is what promotes those classic masculinizing features.
All right, pay close attention here. This is a big exam alert. You've got to know about anti-androgens. Just like the name says, these drugs work by blocking what androgens do. The 2 you absolutely have to remember are finasteride and dutasteride. They're most commonly used to treat an enlarged prostate, also known as BPH. Okay, let's switch gears and talk about a topic that is, I promise you, super high yield for the PTCB, treatments for erectile dysfunction. So first off, what exactly is ED? Well, it's defined pretty simply as the inability to get or keep an erection. What's really important to remember is that the causes can be all over the map, from physical things like a disease or even a side effect from another drug to psychological factors.
You guys, you have to know this table. It's basically a cheat sheet for the exam. You'll want to memorize these generic and brand names. So notice sildenafil and vardenafil both last about 4 hours. Avanafil is the speedy one. It works fast. But the real standout is tadalafil, or Cialis, which is known for being super long-acting. We're talking up to 36 hours.
Okay, listen up, because this is probably the single most critical safety warning in this entire lesson. Big red flag here. You never, ever dispense ED medications with nitrates, like nitroglycerin. The combination can cause a massive, dangerous drop in blood pressure. It's an absolute no-go, always.
All right, let's do a quick rapid-fire review to really hammer these facts home and make sure you're feeling confident for your exam. Here's another term you've got to know: priapism. This is a rare but really serious side effect of ED drugs. An erection that lasts for more than 4 hours isn't a good thing. It's a real medical emergency that needs immediate attention to prevent any permanent damage.
And you know I love a good memory trick. For all these major ED drugs, just look for the suffix afil. Sildenafil, tadalafil, vardenafil. See the pattern? You can think of it like this. These drugs help afill the blood vessels. It's a simple little trick to help you recognize the whole drug class instantly. So, as a pharmacy tech, you're on the front lines of patient safety. Here are the 3 things you always need to keep in mind. Number 1, always check for nitrates. Number 2, be aware of that risk for low blood pressure. And number 3, make sure patients know that an erection lasting over 4 hours is an emergency.
All right, let's wrap this up with one last question to see what you remember. Which one of those ED meds is the long-lasting one, working for up to 36 hours? If you said tadalafil, brand name Cialis, you are absolutely correct. You did a great job reviewing this stuff today. You are totally on the right track to passing that PTCB exam. Make sure you review your notes, rewatch this if you need to, and just keep practicing those drug names. Keep up the amazing work. You've got this.